Here at CEDA, we acknowledge the traditional owners of the lands that we live, work and meet on. We pay our respects to elders, past, present and emerging, and we acknowledge that this land was never ceded. This land always was and always will be Aboriginal land.
Welcome to the CDAH Peers Podcast.
This is a space for peers to chat about what matters to us.
You'll meet peers from Community Disability Alliance Hunter, or CEDAH.
Sharing lived experience with peers and allies.
This series is all about human rights.
Some of these topics are challenging.
So we will make sure there is a clear warning for each episode.
So you can make a decision that's right for you.
So come and join the conversation because there's nothing about us without us. Hello, I'm Kath Marnie and welcome to the CEDAH Peers Podcast. Does it feel really complicated to talk to someone about sex and your body and how to have relationships? And then when you get up the courage, you have to work out where to go. Will you be able to get into the building? And who will you be comfortable to have with you? At CEDAH, we know how hard it is, and we're working to remove these barriers. In this episode, CEDAH peer Suzy talks with Heather Jolly from Family Planning Australia about healthy and respectful relationships, navigating the health system, and the times when people with disability are not even part of the conversation. Just a heads up, you might find some of the things that Suzy and Heather talk about confronting. So maybe give this one a miss and come back later.
Hi Heather.
Hey Suzy.
Thanks so much for coming today and joining us on our podcast. So we met 18 months ago and at a community event and we just clicked straight away because we had such similar passions, mine being like women's health, and we just wanted to jump into things straight away and deliver some information to our women's group to start with, and it's just gone like bigger than we expected. So coming in, what were the biggest barriers you found for women with disabilities to other women without disabilities?
Yeah, it's a great question. Thanks so much, Suzy, and thank you so much for having me here. It is such a joy to be here with you and at CEDAH. So yeah, thinking back to a year and a half ago, I connected with some community peers at an event, and I was new to the area. I was new to the Hunter area, and I wanted to get a bit of an idea of what was important to people and happening in the disability space in the Hunter. And certainly, you and I had a pretty good chat about women's health issues that were, really important to people who had disability and lived experience of disability. And some of the main issues which came up were around accessibility. And so I guess that covers a lot of things. So accessibility as far as information goes, is information accessible for people with different types of needs? And also accessibility when people actually make it to an appointment. So if you get through those first barriers and can get to a healthcare appointment and want to go, what's that environment like? What's the waiting room like? What's the room like? Do you have the choice of a male or a female doctor or nurse? There's actually a lot of things. I could probably go on for ages, but I think that's a few of the main ones.
I remember, Heather, bringing some of the concerns from our peers to you with some feedback on why they haven't gone, and I was really shocked with some of the responses of, some medical professionals saying, you don't need to have that done, or that's not really important, or sorry, we just can't do it because of your disability. Like, was that shocking for you?
I wish it was shocking. Disappointing, but not surprising. So I work for Family Planning Australia, and my role is on the health promotion team and on a project concerning cervical screening and people with intellectual disability. but I've been working with people with disability for many years in different roles, and I have heard these issues that you mentioned time and time again. A really common one is what I refer to as not applicable. So what we hear a lot, unfortunately, in healthcare spaces is healthcare workers saying that a person with a disability is not applicable for a type of education relating to sexual health, or not applicable for certain types of appointments or procedures because they have a disability. So therefore they're not a sexual being, which is obviously terribly wrong and distressing.
So Heather, I've heard you come and talk to our youth group, Next Gen, and we talked a lot about sexual health. And it's really important because sometimes that education doesn't get to young people with disability. And from my experience, some of them don't understand that, you know, just because you might be taking a contraceptive, it doesn't stop sexual diseases and things like that. So, like, how important it is for you to be able to give that information to young people with disability?
Knowledge is power. People deserve to have knowledge and people can handle it. So, you know, when we talk about human rights, sexual health and reproductive rights are human rights. And education, information is a massive, massive, massive part of that. I know at CDAH and in other community organisations and in the disability space in general, we hear a lot, the term a lot, nothing about us without us. And certainly if people have good quality information that's accessible and presented in a way that's respectful and that people can understand, they can take that and make good choices. So it was a real privilege to hang out with the youth group and learn from the group about what's important to them. And, you know, people might be amazed to find that what's important to young people in a disability group isn't that different to what people in other groups in the community find important. And it really starts with education and information. So people feeling like they've got education in a way that they can really understand and do something helpful with for themselves. Have I got the information and a sense of empowerment where I can make a call and book myself in to see a doctor or nurse for a sexual health screen? Have I got the information I need to maybe ask someone out on a date and do it in a way that's respectful and appropriate? Because, you know, when we're talking about sexual and reproductive health, the body is really important. So, you know, we're talking about things that maybe come to our mind as a bit more obvious, like a sexual health check or an STI check, for example. But it's more than that. It's about relationships with others and relationships with ourselves. And
can you, sorry, Heather,
yes,
what's
please.
STI stand for?
Thanks for asking about STIs. So STIs it stands for a sexually transmitted infection. And so those are types of infections that are spread through sex. And definitely, like any other matters to do with the body, if people are worried about something with their body, about something with their sexual health, it's really important to go and see a doctor or nurse to get a little bit more information about that.
So Heather, what if you don't feel comfortable going to your doctor and you think that there's something wrong with your body, whether you're male or female, and, you know, where can you go and get more information if you don't want to go to your family or your
regular
friends?
GP. Yeah. It's a really important question, and I find it something that comes up a lot in regional and rural areas, actually, Suzy, is because a lot of people have a GP that maybe is their family GP, maybe they've had for a really long time, so it can be a little bit uncomfortable for them to talk about matters that are a bit more private, like sexual health. So Family Planning Australia has a clinic in the Hunter. And we also have a talk line that's open from Monday to Friday where people can chat. So write in a little chat on the internet. They can call and have an anonymous conversation with a nurse about the type of questions we're talking about. And of course, we have clinical service as well, including a youth drop-in. So a couple of days a week, Tuesdays and Wednesdays, people under 25 can pop into the Hunter Clinic in the afternoon without an appointment. And that can be a really important, you know, barrier to consider for I think for all people, but for young people, sometimes having to, book appointments and stick to them because of all the things that happen in life can be pretty tricky.
And so, Heather, is Family Planning Australia's information accessible for people with disability?
So as far as accessible information goes, yes, it is very important at Family Planning in Australia that we make accessible information with and for people with disabilities. A project that we're working on at the moment called Screen Equal is a co-production project which I've had the absolute pleasure of working with some peers from CDAH on. And that project is about making information for people with intellectual disabilities about the cervical screening experience and the different steps along that way. So the beginning of finding out, do I need to have a cervical screening test? Right through to what happens at a test, what are people's choices, and what happens afterwards. So what happens after someone, if they choose to have a test, what are the next steps? So always thinking as well about a co-production and making sure that, as you say, nothing about us without us.
Yeah, because it's really important for us to have informed decisions because we don't want people making decisions on our behalf. So having those videos and support, as you said, the online chat to be able to ask questions back and forth so we actually know ourselves is really important. So.
Yeah, well, you are really important, and supported decision making is really important, and people need to really believe that you have access to really good quality healthcare, really good quality sexual and reproductive healthcare, and that your voice is included in every step of that process. Sometimes I notice when I talk to people about healthcare and supported decision making, I say, if it's a bit loud in the middle of the day at an appointment, do you think it might be helpful to try and get an appointment at the beginning of the day or the very end of the day? Maybe we could ask for if it's a person that identifies as female, to see a female nurse or doctor, or a person that's male, a male nurse or doctor. And it's like really quite amazing how surprised people are sometimes that they have those rights.
So what does it mean when we talk about sexual health? Does it just include that?
So glad you asked, because definitely the body's a part of it, and probably the thing that I guess most people think about when we talk about sexual health and health, we tend to think about illness and the body, but sexual health and good sexual health is so much more than that. So we're thinking about the mind and we're thinking about socially. So thinking about the body, the mind and socially. So we've talked about the body, so we'll park that. When we're thinking about the mind, we're thinking about how do we feel? Do we feel good? Do we feel like we're empowered to access information? Do we feel like we've got the knowledge we need to make good choices for ourselves? In terms of socially and relationships, do we know what a healthy relationship means? So Suzy, you mentioned the youth group before. And not just this one, I've been lucky to work with lots of other youth groups where I say, we're going to talk about healthy relationships. And they say, look at me, and they say, like, well, what does that mean? What does a healthy relationship look like? So starting there, helping people to understand what does a healthy relationship look like? What does an unhealthy relationship look like? Pleasure, what role does that play? And how important it is for people with a disability to understand that pleasure is something that you're absolutely entitled to have and to enjoy. And pleasure also means the absence of harm. And so people knowing that if something happens that is not okay, that you are absolutely empowered and allowed to go and do something about that.
So Heather, you and I, and we've talked to the next gen, our new youth group, about consent, and it's really important topic for young people and for everybody. But this is something that you talk a lot about with passion, actually, I must say.
Thank you, and it's really important. And again, this comes back down to education. People need to be taught about consent, and we need to check that people understand and not make assumptions that people know what it means. Even that word, when I ask people, do you know what it means when I say it? Because people generally want to agree with you, but when you break it down, maybe they don't. What we're really talking about is permission. It's people knowing that they own their bodies and that other people own their own bodies, and that we always need to be checking with each other around permission. And that might be something more simple like a hug. we talked before about some people are just not huggers, and not making assumptions around people's bodies, but also through to more serious issues like sexual assault. People need to understand what consent looks like and what their rights are. And also when thinking about going into relationships, knowing how to communicate with other people around boundaries. Often you'll hear those words together, consent and boundaries, permission and boundaries. When we're thinking about an individual, we can help people to understand what it means for them around what consent and permission and boundaries look like for them. And then when we're going into relationships with others, it gets a bit more complicated. So then we need to be learning, what does that mean for others? And it might not be the same.
Yeah.
So if we're talking with a young person's group, and maybe we've got a young couple there as an example, and one person's really touchy-feely and one person's just not, how do we help that couple to communicate, to understand what each other's boundaries are and to respond to that in a really healthy way?
So Heather, consent isn't always just saying yes or no, is there?
No, absolutely right. And it's not always verbal too. And when we're thinking about disability, people have lots of different ways of communicating. So we really need to think about on an individual level what someone's communication needs are and work out what that looks like when we're talking about consent and permission and boundaries. There's some helpful tools that are available out in the resource universe. So Planet Puberty has some wonderful resources around understanding boundaries and permission and what that looks like in a relationship space too. And that can be it can be helpful bringing resources along sometimes too when it doesn't necessarily feel like it's just coming from another person, it's coming from a place. So it's coming from a source of truth. So I find that can be really helpful when talking to people about boundaries and permission.
So Heather, when we think about people with disabilities who are isolated and would need to have support, how do you navigate that with Family Planning Australia?
Thank you. That's a really important question. So yeah, I guess we think about we've been lucky to connect with groups here and people that are really connected with the community, and we know that's not the case for all people. Yeah. In those circumstances, while we always want to be making information for, we'll say, a consumer, for a healthcare consumer, and we would always want to be talking to a client or consumer first. In some circumstances, if a support worker is involved in making an appointment or bringing someone to an appointment or maybe getting information for someone, we want to make sure that we're really empowering a support worker or a support person with really good information, helping them to feel supported. We're wanting to make sure that they have resources that make them feel confident in sharing whatever information we're talking about. So if we want a support worker to assist someone in attending for a cervical screening test, we want to make sure they've got the information they need to help their client. Having said all of that, the client is number one. The person with disability is number one. So if that person gets to an appointment with a support worker, we want to ask them, do you want your support worker to come in with you? Yep. If the answer is yes, then that's absolutely fine. That's the person's choice. But then we also, when they come through the door, want to make sure we're talking with the client and not with the support person. So the support person certainly plays an important role, and we may need to work together very closely to meet the needs of a client or a consumer, but the client-consumer is always number one.
Heather, what's something that you've learned or experienced in the time we've known you about people with disability?
I've learned that it's really important to have lots of quality conversations before, whether it be resource development or making an education session, to talk with people about what the unique needs of a particular group are, even better individual needs are, so that you can make sure that you're providing education and information in a way that everyone feels included and that everyone really gets something out of. And the other really important point is to remember that people with disability have the same rights as anybody else in terms of sexual and reproductive healthcare, and any healthcare for that matter, and to feel empowered and safe to be able to access services, supports and healthcare in that space.
Thank you so much for your time today, Heather. It's always great catching up with you.
It's great to be here and great to catch up with you too, Susie.
I really hope you've enjoyed this conversation with CDAH Peers Suzy and Heather Jolly from Family Planning Australia. By the way, you'll find some of the resources that Heather mentions in the show notes. I'm Kath Marnie, and we'll catch you next time for the CDAH Peers Podcast.
Thank you for joining us on the CDAH Peers Podcast.
This podcast has been made by peers at the Community Disability Alliance Hunter.
If you've enjoyed this conversation, you can follow us and subscribe so you don't miss an episode.
We aspire to best practice, and that's why this podcast is made in many accessible formats.
If you would like to learn more about this podcast and CDAH,
Head to cedah.org.au/podcast.
Technical production by Tim.